Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great exercise. In fact, it's the best exercise I know of in 28 years of orthopedic and chiropractic practice for neck or cervical spine degenerative disc disease. Hope this one helps you. So this is my favorite exercise, which I call the best exercise for cervical or neck degenerative disc disease. I give this one a lot to my patients, and we've had great success over 28 years with this strengthening and coordination exercise. It entails corrections of multiple body areas all in one, which helps to decrease the mechanical stress, which if you've listened to any of our videos in the past, you realize is the #1 root cause of why you're having your pain with degenerative disc disease of the neck. So let's begin. It corrects the typical tendencies of most people to have shoulder blade and forward head and elevated shoulder postures, which over time places a tremendous amount of postural stress on those discs and joints, leading to the wearing out, deterioration, and degeneration of these areas. So we have a typical muscle imbalance of certain muscles becoming very tight and certain muscles becoming very weak. This exercise corrects both parts of that. It strengthens the weak muscles and simultaneously stretches the tight muscles. Here it is. We begin by lying face down and we tuck our hands palms down under our lap. We're going to engage any specific postural problems and tendencies that we have. We're going to correct what we know is unique for our body. If you have a rounded shoulder, a tipped shoulder blade, a tendency to tilt your head or rotate to one side, you want to keep these in mind as you do this exercise so you're correcting those tendencies. If you're not sure about those tendencies, I invite you to go to the Pain Free and Fit website where we have a free body analysis and you can learn what your unique posture and muscle balance stability tendencies are. So in this position, we're going to tuck our tailbone under a little bit so we don't arch our lower back. We're going to squeeze our buttocks together, and we're going to pull our face straight up off the surface. Now, if you notice, I'm avoiding lifting my chin. I'm keeping my chin down, and my face comes towards the back of my head, and then I'm going to pinch my shoulder blades together and hold them down towards my hips. In this position, I'm also lifting my chest just a little bit. Not enough to arch my lower back. That could injure my back. And what you'll be feeling here is a tension as you think about keeping your neck long from the bottom of the neck to the top, a tension between your shoulder blades and the back of your neck as those muscles hold the position. You can hold that from anywhere from 3 seconds up to a minute and then release. You're going to be doing this every other day or 2 or 3 times a week, and you can increase 1 or 2 repetitions every time you do it or add a couple seconds every time you do it. And the idea of this is it's building up the endurance of those muscles that bring our shoulder blades back, that hold them down, that bring the head back. If you notice, I'm avoiding the skull moving down on my upper neck. Okay? The spine is long. I'm not short in my spine. Relax. So by doing this particular exercise, we're undoing that tendency to do this. And by bringing the head back, shoulders back and down, it increases the distance on the back of our neck, avoids the excessive lordosis or curve, and opens up the back of those joints that are getting compressed together, the facet joints. It opens up the back of the posterior aspect of the disc that is usually very compressed in degenerative disc disease. And over time, it allows you to have a more natural posture and decreases a lot of that mechanical load on your degenerative discs in your neck, giving you a lot of pain relief and helping to stay away from future pain problems during daily activities and movements. If you like this exercise, help me share it with others by giving me a like below, a thumbs up. That'll help our rankings to get this out to more and more people that need it. If you have any questions or comments, please leave them. And remember that this is one of many exercises that can help with degenerative disc in the neck. I invite you to subscribe to our channel, learn the others, and get that neck working and conditioning in a better way, correcting your unique mechanics specific for your body and helping to keep you pain-free and fit.